Hey guys, it's Camille DG here again, nurse, NDIS provider, and AI and business consultant. And after logging over 10,000 hours on the floor, I have seen the inside of healthcare, the good, the bad, and the burnt out. I was one of them. And what I'm about to share might surprise you because when most people hear AI in healthcare, they're like, no, really. They think robots, data, or replacing humans, right? That's not what it's about. AI, when used properly, can bring compassion and calm back into healthcare. So today, I'm going to show you what most people don't know about AI in healthcare and how it can change the way we do triage, reassure patients, even before they see the doctor or nurse. And it frees up the admin staff to focus on what truly matters, the people. So let's get straight into it. The hidden problem in healthcare. That is the truth. Let's start with that. Healthcare is drowning, not just in patients, but in processes. The endless admin, the waiting rooms full of anxious people, phones ringing off the hook, and staff who are exhausted before the real care even begins. I've seen all of it. Now imagine if 40% of that load could be handled automatically without losing human touch. And that's exactly what AI can do. It's not by replacing nurses or even the admin team, but by enhancing how we work, communicate, and care. Let's talk about the calm before the chaos. AI in triage. AI can actually be used to screen patients before they even reach the nurse's desk. So if you can picture this, a parent walks into the ED or the emergency clinic with a child who's burning up, high fever. Instead of sitting and panicking in the waiting room, an AI triage assistant starts asking calmly, "Hey, has your child eaten today? How long has the fever been going on for? Are there any breathing difficulties?" And it can collect and summarize the answers. So when the nurse or the doctor sees that patient, they already know the essentials. So no guesswork, no delay, just clarity and calm. That's what real AI in healthcare looks like. Reassurance through structure and empowering admin, not replacing them. Let's talk a little bit about that. Let's talk about the admin. We've all seen it. AI systems can verify patient details automatically through a secure digital ID in the hospital system. That means receptionists are freed up to focus on patient experience and not the paperwork. They can guide the families, manage the flow, and support the care team because the admin load is already done in the background. So it's not about removing jobs. It's about giving people the space to do their jobs better. Let's talk about my nurse AI health companion that I created this year. So it's close to my heart. I don't know if you've seen the video, but you might want to check it out after this. I created a video all about my nurse AI health companion. So let's imagine this. It's 10 p.m. A mum is worried about her toddler's cough that won't stop. She's stressed, unsure if it's serious, and all the clinics are closed. And instead of waiting hours on hold for advice, she opens the AI nurse companion. It calmly asks questions, offers evidence-based reassurance, and helps her decide whether to monitor, give fluids, or seek urgent help. And that's the same tech that can be used to support SEAL houses in the NDIS, where support staff often face after hours health concerns, or even say something had happened, there had been an incident, and the team at the SEAL house would like guidance or just need a safe guided advice until a nurse or a doctor can attend or make a clinical decision. And what is the result of this? There's obviously less panic, there's better decisions, and safer, calmer care environments round the clock 24/7. The bigger picture really is AI in everyday healthcare. It's not just after hours healthcare. AI can support the clinic follow-ups, the patient education. It can do medication reminders, chronic care tracking, even emotional support for isolated patients and participants. Imagine every healthcare provider having a virtual assistant that knows their policies, communicates in their tone, and integrates with their existing systems. So that's where healthcare is headed, and it's happening fast. AI isn't cold technology, it's a bridge between the people and better care. So let's loop this back under the care organizations and NDIS sector. NDIS providers deal with the same challenges, right? The high admin, the complex compliance, the emotional fatigue. So the same tools that support hospitals and clinics can be used and transform NDIS operations too, from documentation, shift notes, generating care summaries, triaging the incident reports automatically and in real time. It's essentially the same goal: better outcomes, less burnout, and smarter use of time. Whether it's healthcare or NDIS, AI gives us the one thing we've all been missing, which is the time to really care for everyone, for people, why we started doing this in the first place. And if you've been hearing about AI in healthcare, you really need to stop picturing robots taking over the sector. You're missing the real story here, guys. It's not about replacement, it's about restoration. Restoring the time, the calm, restoring humanity in the way we deliver care. And at Spacia.ai, we build those AI systems that support healthcare and NDIS providers to streamline admin, improve compliance, and deliver safer, calmer care without adding extra admin staff. So if you want to see how that could look for your organization, book a quick 15-minute intro call with me or our team at Spacia.ai. Again, I'm Camille DG. And remember, AI doesn't replace the nurse or admin staff. It just lets us be human again. See you on the next video.